Welcome to our family therapy. I'm going to start over because that was awful. Welcome to our poster presentation for therapy. We have chosen Virginia Satir and her family therapy. My name is Ryan Sheridan.
My name is Lorraine Black.
I am Chloe Cameron.
And Patricia Varela. So the main objective of this presentation, we are hoping that our classmates will have some insight about the main concept of Virginia Satir's therapy, what her techniques was, and the main goals, and then how was the therapy applied to the family group or just a couple of counseling. And also we're gonna take a small look at the limitation as well. So now Chloe is gonna start with introduction and a little bit about history.
So the Satir transformational systemic therapy was developed by Virginia Satir and also known as the Satir method. It was designed to improve relationships and communication within the family structure by addressing a person's actions, emotions, and perceptions as they relate to that person's dynamic within the family unit. According to the Satir model, the pain people experience is the result of the way they manage their perceptions, expectations, emotions, and behaviors. By focusing on three primary areas, the intrapsychic system, the interactive system, and the family of origin system, people can examine their experiences and relationships, develop goals, and work toward change. The history begins when Virginia Satir was born June of 1916 in Neesville, Wisconsin. In 1936, Satir started her professional career as an educator in public schools after graduating Milwaukee State Teachers College, today known as the University of Wisconsin. While working as a public school teacher, she became interested in meeting and working with her students' parents. She began to recognize that the support of parents not only improved outcomes in the classroom, but unlocked potential for healing within their families as well. She later furthered her education at the University of Chicago and earned her Master's of Social Work degree in 1948. From there, she began her private practice and was later offered a position at the Illinois Psychiatric Institute. Prior to the 50s, in Virginia's systemic theories, the pathologized individual was taken away, treated, and then put back into the family. But this method proved to be ineffective as frequently the individual typically relapsed into their old behavior. By the end of the 1950s, Satir co-founded the Mental Research Institute in California, where the first ever family therapy training started with Satir as a training director. Here, she addressed and taught the importance of dealing with the whole family during treatment instead of the individual client. During the next decade, she pioneered work on family therapy and used many innovative techniques described in her first book, Conjoint Family Therapy, published in 1964 as a manual for professionals. She also created the Satir change process model, a method of change derived from her own clinical experiences and trials. The model is widely used in the corporate world today to understand the effects of change. In the 1970s, Satir founded two groups, the International Human Learning Resources Network and the Avanta Network, renamed today as the Virginia Satir Global Network. Both groups were aimed at helping mental health workers access necessary resources and support for their work. Virginia spent almost 4 decades practicing therapy, teaching, and running workshops across the world. The influence of Satir's research and work can be seen even today in modern psychotherapy, neurolinguistics, and family constellations. In terms of the main concepts, all of Virginia Satir's work is classified under the umbrella of becoming more fully human, and she conceived the process and concept of human validation. The human validation process is a systemic therapy approach that focuses on family growth and health rather than dysfunction and pathology. The foundational concept of the Satir method is the belief all people are connected through universal life energy, which can be accessed to achieve transformational change, develop and strengthen relationships, change behaviors, and develop positive life energy. Other important guiding concepts of Satir's method include, but are not limited to, the principles such as All people possess the necessary coping resources to face life challenges, though some may have yet to access these resources or may view any or all of them negatively. Problems stem from the way people cope with them, not the problems themselves. Treatment should focus on health, possibilities, and hope, not pathology and problems. And treatment should utilize life energy to facilitate the natural healing process. And the concept that we are in charge of our emotions. We can choose to hold on to positive feelings, which prove validation, and let go of negative feelings. Essentially, Virginia taught people how to view the family as a system, which had certain rules. She helped them to identify rules regarding communication, managing differences, behavioral styles, making clear contracts associated with self-confidence or the idea of pot, and developing healthy systems which are described as teams based on people having similarity of spirit and diversity of strengths. Once the rules in these areas are identified, people are then able to see the rules, to see the consequences of these rules, and to practice the rules they wanted in the future. Now I'm going to pass it on to Lorraine.
Yes. So we're now going to talk about the strategies or techniques that are often used in this model. So these techniques incorporates genuineness of the therapist and also to help the dysfunctional relationship within the group to find change with themselves and to become more connected to each other. Okay? So first is contact and integration. In contact technique, the family members would reach out using body positioning, eye contact, and facial expression to make contact with each other. The integration technique consists of identifying role differences of each client, such as role as a daughter, role as a parent, role as a teacher, or as a wife, and then identifying their inner resources or resources provided by their minds, such as fear of criticism or their desire or their playfulness. And then identifying the present view of these role differences as and inner resources, such as family rules, labels, acceptance, or disregard. The therapist will the therapist and the client will work through a conflict through identifying and recognizing the integration of differences and finding their self-worth. Okay? The next technique is family sculpting. So in this approach, each family member is involved. The positioning of the family is like in a live portrait of how they will present his or her perception at the time. For example, an emotionally close members will be positioned standing together with arms linked, and an emotionally distant member is placed across the room. The person perceived as powerful is represented as standing on a chair. So the communication stances in the sculptures demonstrate the perception about he or she experiences from other members' nonverbal communication. So the members will share his or her feelings and perceptions about the experience. For example, the therapist may ask, "What would you like to say to your mother as you see her in this position in a sculpture?" So the goal of this technique is congruency in communication or communicating without attacking each other and sharing safely without the fear of conflict. The next technique is the iceberg. This is a therapeutic technique that uses a metaphor of an iceberg to represent a human experience as an overall process of developing relationships. So the key idea behind the metaphor that is the ice above the water is our external actions. It represents our behaviors, our coping, our perceptions, while the ice below the water represents the below the surface feelings that includes expectations, yearnings, and core beliefs. Satir emphasized that relationships are like icebergs with only a fraction of experiences being seen while the majority are hidden and submerged. So, for example, a therapist may ask, "How do you feel at this moment seeing the possibilities for your family?" So, this is gaining a deeper understanding of the interpersonal forces that shape the communication and the coping strategies. The last technique is the self mandala. So the mandala itself is a circular design, symbolizes the idea that life is never ending and everything is connected. So this approach is like a dramatization or role play, and the family member will be tied together on a rope, that, and then one member represents like being inferior or the one that will hide under the blanket, one that will be the powerful, and other members will be walking clockwise or counterclockwise. So the one covered up in the blanket is instructed to create much chaos as possible. And the purpose of this is to give a client that he or she wants to be seen or heard, while others, that's a constant movement and tangling of the ropes, create a situation in which everybody experiences some physical discomfort. So the client is asked to discuss his or her reactions, feelings, and observations throughout the process. And through chaos, the ultimate purpose of this process is to get all the family members in harmonious situation, and the client will be aware, will be accepting, and taking charge of each member in the present. Okay, I'll now pass along to Patricia.
So good job, Lorraine. So what Lorraine pretty much said is probably what I'm going to be saying again, but more in summary. So I have application of the therapy, which pretty much is used for family therapy. The main thing with that is to create a good communication and family reconstruction. So what Virginia Satir did is that she said that people often seek therapy because they are having a family conflicts. And that doesn't necessarily mean that the person that she called identified person instead of called the sick person doesn't necessarily mean that that person is the person that is bringing the conflict or the person that is starting the conflict, but is the person that is mainly affected by the conflict. So for example, if a parent is going through a divorce, maybe if they have a kid, the kid will be more affected. So that's going to be the unidentified person. And for example, also I was watching a YouTube video when a family member, sister was having a lot of issue with the mother, but the brother was like the mediator and always find the solution. But because the brother was going to college, they felt a need to seek a family therapy because he's not going to be around, so they need to figure it out how things are going to work between mother and sister. So there, the brother was the one seeking the therapy, but he was not the identified person. So that's how Virginia's therapy worked. So mainly just to bring family to homeostasis when they are off balance. Also, this therapy was used in a group. So mainly it just make the group, the members of the group created a safe environment so they can share their concern. It can be like a friends, it can be like couple that are being through a challenge in the relationship. It can also be individuals that are just friends. It's just, it cannot just be like, because when we say a family, people just say, think about family members, but sometimes our family is not our blood related. So it can be applied to a group of people that are just friends, so such a thing. So now I'm gonna go to the main benefit and main goals. So Ryan is gonna take it over that one.
Well, thank you. So again, I'm going to touch on the benefits and the main goals from the therapist perspective and the client perspective. And some of them will be focused on what we've touched on already, but there'll be some more details. For the therapist, it's important to note that it's an existential-based therapy. And by that, the therapist is the most important tool in the therapy session, with use of themselves as the tool, and they're using empathy, warm regard for the clients, and just their sense of presence are the most important pieces of the therapist. It's also important to note that this is not pathology focused, so the therapist doesn't necessarily make diagnosis based on individual, perhaps personality disorders or otherwise. It focuses on the relationship itself. What this leads to is the goal of the therapist, and that's in assisting the clients to maximize the individual and group dynamics. So their goal is to make the group function at its best. On the client side, the benefits are it's change oriented. So the objective is to make changes so that the clients individually and as a group can overcome the challenges of each individual and the group, as well as to develop strength, individual courage, and esteem to help overcome challenges in the future. It also fosters focus on the individual within the group, and that means the individual gains perspective on self-awareness, interpersonal skill building, and responsibility related to their role in the group. And so a goal for the client in this regard would be the improvement of the group dynamic by improving themselves in the context of the group. This looks a lot like congruence in terms of authenticity between the group members and to oneself. And ultimately, the goal is self-actualization, the highest point of Maslow's hierarchy of needs, and helping each individual achieve their maximum potential. So now I will pass it back to Patricia for limitations and challenges. Excuse me, Lorraine.
Yes.
Lorraine would.
Okay. So we're now going to look at some limitations or main challenges of Satir's family therapy approach. Despite the benefits and effectiveness, the critics perceive that this type of family therapy may not benefit some people, especially those with severe mental health conditions like schizophrenia or those having cognitive impairments. Because Satir's approach uses role playing and dramatization, the client must be an acceptable level of daily functioning in order to effectively participate in this kind of group. They may perceive the rope in Self Mandela as different as we perceive it. Some critics also argue that there's a lack of empirical support, and they suggest that the future research studies should seek to use either experimental or quasi-experimental designs that can provide a rigorous levels of evidence. The design that can be used for experimental groups receiving Satir's approach is compared with other groups receiving an alternative approach and can be used to assess different recurrences, timing, setting, and other factors that will evolve within the Satir's family therapy. Studies also should include larger and more representative samples to increase the generalizability of the findings. More attention is needed on a specific subpopulation of clients and therapists. Not all agree that the applicability of these techniques to culturally diverse populations because of the assumption that the model focuses only on the individual versus the collective client. Satir herself was highly sensitive to the ways in which therapy is individualized. Therefore, it is necessary for future research to be more sensitive to how particular types of families will experience this type of therapy approach. And lastly, there are several visual versions of these techniques, especially the iceberg currently exists with slight differences in labeling and text. Therefore, future studies convene to establish first a set version of the visual and second, a clear guideline for the use of this helpful tool. And I'm now going to pass along to Patricia.
Yes, so now I'm going to go to a conclusion. As we see throughout our presentation, the Satir transformal systemic therapy is a family therapy that has many benefits. She applied two approaches in her theory, the family history, which we pretty much talk about, like Lorraine talked a lot about like how she applied her theory and get some history from her patients, not patient, but the member of the family. And then she focused mainly on the communication part in between those family members. She applied experiential technique which probably was one of the things, like with the research that Lorraine was talking about limitation. That was the only thing that she used in terms of experiment. And that will just enable family with opportunity to change and also to explore and see how they can make a change to accommodate the whole members. She also recognized their communication pattern, and she believed that to be effective in addressing mental health problem, the family need to be experiential, to be like they experimenting, but like this theory does not apply for people that has let's say a chronic or a very bad severe mental health. So that was like one of the limitation, and still there is a lot of challenge with this therapy, even though there is a lot of benefit, but there's still a lot of challenge. So we're gonna end here, and hopefully you guys got something from here, from our presentation.